We begin tonight with some big changes announced by the province's Chief Medical Officer of Health.
That's right, the Ontario scrapping the mandatory 5-day isolation period for people who test positive for COVID-19.
Dr. Kieran Moore also announced kids between the ages of 5 and 11 will soon be able to book a COVID booster shot. Matt Ingram has the latest.
A change to the rules ahead of an expected rise in illnesses this fall.
So this is an all respiratory virus approach because the complexity will be increasing this year given that other respiratory viruses will be circulating in our schools and workplaces.
If you have COVID-19 or any respiratory virus symptoms, Chief Medical Officer of Health Dr. Kieran Moore says you should stay home until your symptoms are improving for 24 hours. No more mandatory 5-day isolation, meaning people testing positive for COVID can go back to school or work.
The levels of immunization across Ontario are improving day by day, and hence we now can have a more permissive approach.
Moore is also advising anyone with a fever to stay home until it's gone, and says everyone with symptoms should wear a mask in public for 10 days after the onset.
I'm deeply concerned about this decision to remove the 5-day, the 5-day isolation requirement.
Liberal Party health critic Adil Shamji thinks Moore is making a mistake given the current crisis in the healthcare system.
Well, we've got ERs closing, ICUs closing, nearly 1,400 people admitted in hospital right now with COVID-19, and we're not even in respiratory season yet.
Also announced today, kids between the ages of 5 and 11 can book a vaccine booster shot starting tomorrow at 8 a.m., but some parents aren't interested.
Yeah, I think she's good.
I'm really not sure where I stand on her getting vaccinated just as yet.
Others say they will get it for their kids.
Eventually, maybe in the fall.
Oh, definitely. If I'm going to get her vaccinated, then why not get a booster as well?
I'm completely for it. I think anything we can do to keep our kids healthy and the community healthy is very important, and so we'll be getting the booster.
We know that its safety profile in this age group is very, very good.
Pediatrician and infectious disease specialist Dr. Jeffrey Pernica recommends parents get their kids vaccinated and boosted.
Because I think it offers much more potential benefit than harm for kids aged 5 to 11. You know, COVID-19 is not going away and kids will be hospitalized with it.
But he also says the risk of severe COVID among kids this age is very low.
The likelihood that a young school-aged kid will get severe disease with COVID-19 is not high.
The City of Hamilton says it will be adjusting its public health guidelines to align with the province. It also says that today's announcement comes a week after the National Advisory Committee on Immunization recommended booster shots for the 5 to 11-year-old age group.